Nymalize, also known as nimodipine, is used to reduce complications caused by a specific type of bleeding in the brain known as subarachnoid hemorrhage, SAH. It is classified as a calcium channel blocker. When there is bleeding in the brain, the body's natural response is to narrow the blood vessels to slow down blood flow. However, this can actually cause more damage to the brain. Nymalize works by relaxing the narrowed blood vessels near the area of bleeding, allowing blood to flow more easily. This helps to reduce brain damage. It is important to take Nymalize as directed by your healthcare provider and to discuss the best time to take it for your specific situation. Before starting nimodipine, make sure to read the patient information leaflet from your pharmacist. This medication should be taken as soon as possible after the start of bleeding in the brain, usually within 4 days. Your doctor will provide specific instructions, but it is usually taken every 4 hours, 1 hour before or 2 hours after a meal. If you are taking the tablet form, swallow it with a full glass of water, and do not lie down for at least 10 minutes after taking it. If you are taking the capsule form, swallow it whole, and do not mix the contents with other liquids. If you are using the liquid form, be sure to measure the dose accurately and avoid using a household spoon. It's important to avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. The dosage will be based on your medical condition and response to treatment, and it's important to take this medication regularly at the same times each day. Do not suddenly stop taking this medication without consulting your doctor, as it is usually taken for 2 to 4 weeks. And as always, make sure to consult your doctor if your condition worsens. Some common side effects of Nymalize include dizziness, lightheadedness, flushing, or swelling ankles/feet. To reduce dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you experience any serious side effects such as fainting, slow/fast heartbeat, severe abdominal pain, stomach bloating, inability to have a bowel movement for more than 3 days, severe nausea/vomiting, or vision changes. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. And remember, always consult your doctor for medical advice about side effects. Do not administer Nymalize by injection, as it can lead to serious or rarely fatal side effects such as low blood pressure and slow heartbeat. Please consult your doctor or pharmacist for more information. Before taking Nymalize, it's important to let your doctor know if you have any allergies to nimodipine or other similar medications, as this product may contain inactive ingredients that could cause allergic reactions. You should also inform your doctor about your medical history, especially if you have had chest pain, low blood pressure, recent head injury, or liver disease. Nymalize may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, you should talk to your doctor about it. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Nymalize, especially dizziness and swelling of ankles/feet, which can increase the risk of falling. If you are pregnant, Nymalize should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication can pass into breast milk, so consult your doctor before breastfeeding. It's important to follow your doctor's recommendations and take Nymalize at the prescribed dosage and at the optimal timing for your specific condition. It is important to be aware of how Nymalize may interact with other medications. This can affect how Nymalize works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are certain medications that can affect the removal of Nymalize from your body, which in turn may affect how Nymalize works. These medications include apalutamide, cimetidine, enzalutamide, ivosidenib, lumacaftor, mitotane, azole antifungals, such as itraconazole, macrolide antibiotics, such as erythromycin, rifamycins, such as rifabutin, St. John's wort, and drugs used to treat seizures, such as carbamazepine, phenytoin, among others. It's also important to note that some products may contain ingredients that could raise your heart rate or blood pressure. Make sure to inform your pharmacist about all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. If someone takes too much Nymalize and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Nymalize with anyone else. Your doctor may also want to monitor your liver function, blood pressure, and heart rate while you are taking this medication. Be sure to keep all of your medical and lab appointments and consult your doctor for more information. If you forget to take a dose of Nymalize, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Do not take double the dose to make up for the missed one. When it comes to storing Nymalize, it's important to keep it at room temperature, away from light and moisture. Make sure not to freeze it or store it in the bathroom. And as with all medications, keep it out of reach of children and pets. When it comes to disposing of Nymalize, it's important not to flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, it's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.